Everyone, my name is Kavita Batra and today we are going to present our project which emphasizes on babies born with addiction suffering from a drug withdrawal syndrome called neonatal abstinence syndrome or NAS. NAS manifests immediately after birth among babies of drug-dependent mothers, following abrupt discontinuation of in utero exposure to certain substances, for example, addictive illegal or prescription opioids. NAS results in nearly 75 to 95% of cases following maternal drug abuse during pregnancy. Therefore, opioid dependence among pregnant women emerges as a public health concern, particularly among countries with high opioid consumption, including United States, Canada, Australia, and other European countries. While data related to drug use, morbidity, and mortality are available, the collective evidence providing country-wise comparisons of NAS incidence is lacking. Moreover, the risk of NAS varies with the type of prenatal opioid agonist use among drug-dependent mothers. Therefore, we had two objectives for this literature review. First was to compare the NAS incidence across countries with high opioid use, and the second was to examine the risk estimates of NAS subsequent to prenatal opioid agonist pharmacotherapy.
Everyone, my name is Guadalupe Mercado. I am Kavita's mentee, and for our review, Kavita and I performed our own independent searches using library databases, scholarly and open access journals for any reports of NAS incidents and also those that provided risk estimates subsequent to drug replacement treatments using the key search terms displayed in our table number 1. We included peer-reviewed nationwide population studies over the past 15 years, so this time range is from 2004 to 2019. Our detailed content analysis and data extraction is also shown in our table number 2. So, out of the 15 studies that were included in this review, only 6 of them reported NAS incidents, and most of them used administrative data or the International Classification of Disease Diagnostic Codes. The remaining of the studies were used in the evaluation of our sub-analysis to determine the risk estimates of NAS subsequent to prenatal opioid agonist therapy. So what we found is that regardless of population characteristics and regardless of demographic profiles, the incidence of NAS were comparable in countries such as Canada, United States, and Australia. So in Canada, we saw an incidence rate of 5.4 per every 1,000 births in 2014. In the United States, we saw an incidence of 5.8 per every 1,000 births in 2012. And in Australia, we saw an incidence rate of 5.0 per every 1,000 births in 2011. Our sub-analysis also showed a lower risk of NAS development following prenatal buprenorphine maintenance therapy when compared to methadone maintenance therapy. The odds of developing NAS increase with the increasing amount dose of methadone. For example, if you pay attention to our table 2, row 2, the study done by Dryden, the group with a dose of over 90 milligrams was nearly 4.8 times more likely to develop NAS as opposed to the group that was receiving less than 29 milligrams per dose. The hospital stays of the buprenorphine maintenance therapy group was also 7 to 10 days shorter than the methadone maintenance therapy group. So overall, our findings are important in assessing the neonatal impact of maternal drug abuse in the context of geography and treatment. Our results also highlight the need for a standardized maintenance protocol to improve the outcomes of mother-infant dyads. Thank you so much for listening, and if you all have any questions, please let us know.